Hello, good afternoon. My name is Dr. Valeris. I am here to discuss all about tuberculosis this afternoon. And before I go into that, I want you to like, comment, invite your friends to our channels. So, you can also follow us on Telegram for you to get into the live videos because that is where you can ask a questions. We are on General Health Discussions as Facebook page, Dr. Verily TV on Facebook page, and Dr. Verily TV on YouTube. You can also join us via our link on Telegrams. You can follow us on Twitters, Dr. Verily. This time I want to discuss about tuberculosis. Like we know, tuberculosis is a disease that affects the lungs. It's caused by bacterial tuberculosis. It does not affect only the lung, it can also affect other parts of the body, which is also known as extrapulmonary tuberculosis. Tuberculosis is very dangerous. It's caused by a bacteria called mycobacterial tuberculosis. It affects the bones, which is also known as bone tuberculosis. It affects the skin, it affects the lungs, it affects all that part of the bodies. Tuberculosis, signs and symptoms of tuberculosis. One, cough at least more than a week. Coughing with blood, we call it hematemesis. Dysphonia, loss of weight, dizziness, and so on and so forth. The tuberculosis that affects the lung is called pulmonary tuberculosis, while the one that affects other parts that do not affect the lung is called extrapulmonary tuberculosis. Pulmonary tuberculosis is easy to be cured than extrapulmonary tuberculosis. The treatment of tuberculosis, extrapulmonary tuberculosis, lasts for 6 months and it contains intensive and continuation phase of the treatment. The treatment for extrapulmonary tuberculosis lasts for 1 year, which is 12 months. The intensive phase of the treatment is 2 months, while the continuation phase of the pulmonary tuberculosis is 4 months. Tuberculosis can be transmitted through airborne disease when when an infected individual or person cough or release a substances into the air. As soon as you inhale the material, as soon as you inhale the particles, you will also be infected, except even if your immune system is strong to attack the virus. Management of tuberculosis. Tuberculosis can be managed either by preventions, by curations. By preventions, which is involved in health education to the clients, adequate personal hygiene, isolations of infected persons, avoid overcrowdings, coughing inside elbows or handkerchief, usage of face masks, protective equipment such as face masks, The management through medications contain the four different types of drugs such as isoniazid, ethambutol, rifampicin, and pyrazimide. Diets to be taken during the tuberculosis. Avoid the substances that will irritate the tuberculosis, such as pepperish foods. Avoid fried foods. Take excessive waters. Adequate diet is highly encouraged. Avoid dangerous lifestyles such as negative lifestyle, cigarette smoking, drinking of alcohols, and other substances. For more discussion, you can visit us on our telegrams. Visit us on our telegram via our link. The link will be posted on the descriptions.